Hello everyone, my friends, and I'd like to share a bit about situations where we have a completely damaged tooth, most of which is hidden under the gum. Naturally, I initially recommended the patient to remove this tooth and place an implant. The prognosis for this tooth will be much better, but we are now on track to prepare it for a crown. The problem with the lower fifth tooth is that almost the entire vestibular wall is missing. She had a deep chip and wanted to restore it, but couldn't. So she came to me. The tooth is hidden, and my task was to prepare this tooth for the buildup in order to prepare it for a future crown, restore the entire structure. Of course, we had to work with Disney here. My assistant asked yesterday how are we going to isolate here when we have such a deep defect? Well, if the chip is at the gum level, then it's still possible to perform the inversion of the scarf and all. But if the chip is at the bone tissue level, then we have to work on increasing the biological width whether we want or not, and only then think about further preparation. The next video is about the isolation stage. We have installed a clamp, a retraction clamp, a brinker. Now we are using Fulente. We have already exposed the entire part of the tooth, performed some bone and soft tissue work, and now we are executing more detailed isolation. We have used a lot of Teflon tape to keep the field dry. Basically, we isolate, and also lay down a Teflon flagellum. Here you go. We see that in essence, there are fewer micro leakages, less micro leakage. So in principle, such defects can be isolated too. You can execute a quality buildup if you work bimanually with two tools. If necessary, an assistant holds a mirror for us. If we work on the lower jaw, then we don't need to hold a mirror, we can see ourselves. And of course, magnification is critical to us.